Yeah, good morning. I'm Jacqueline Bowman, and I am the founder of Third Eye, which is a cause-based SME, so small to medium-sized enterprise. I will actually be in the panel about the DRACHI Vision, and to me, that has been. I was so excited to be invited for that because, having been in the whole Brussels environment since 1995, let's just say I've seen the wheels turn extremely slowly. And coming into this new mandate, I was thinking, okay, it's going to be, repackaging for same old. But what I'm starting to see is that we're moving from the only high-level political will more into the how to. And that's why I'm so encouraged by this conference, because we're actually rolling our sleeves up and saying, what have we got already so that we don't have to reinvent the wheel? And so my message to everybody coming, and I'll be discussing this in my session, is that we don't need to reinvent the wheel. On my panel, we're going to look into the DRACHI Vision, competitiveness, the compass, and where is the infrastructure for all of that? And I'll be talking, and this really is my key message. When you think about, as in my case, infrastructure for innovative health service delivery of obesity, it goes for every other major chronic disease, not least the various types of cancer. So for me, it's going to be a message of see what the current governance structure and digital structure and health service delivery structure allows us to do already, cross-map it into tools such as our blueprint for shared value in health service delivery for obesity, and let's make it work, because there are only so many hours in the day. We finally have the opportunity to move from dialogue into benchmarking, delivery, and seeing some concrete change, which is, I would say, user-centric. So not just saying, well, it's me, whichever stakeholder group you belong to, but actually saying this is going to work enough for everyone involved to mean that we'll have efficiency, competitiveness within Europe, and that we're actually able to come back into being a shining light to other regions. This is such an important question, because I think a lot of people, particularly in Brussels, tend to think about our little bubble. And I'm speaking as somebody who has lived in 4 countries, 2.5 continents, if you count the UK, because, Brexit, one of them being South America, because I'm South American born. And also having worked, I started off in global health, and I'm now going back to global health. But I also sit in other fora as an expert at the European Medicines Agency, as well as through the European Commission. And I think that what a lot of people don't realize is that key medicines agencies and regulatory bodies in Europe, in Japan, in the US, in Canada, in the UK, are actually used as references. So for should we say, not as well developed systems, they can actually go and get advice from these key agencies. So to me, if we're actually coordinated, whatever we do, for instance, at the EMA, and this is not my day job, just to be clear, I just happen to be there for policy and citizens' rights for obesity. But whatever we do in Europe, has a direct effect of these countries beyond our region who are actually needing to come get advice. And that's also the same when we start looking at supply chain, when we start looking at decentralized distribution of, for me, I'm looking at cold chain because of obesity medication, or not because of all of these oral therapies. And that's the same for cancer. All of these different creams that patients need to use, all of this starts to count. So when we actually start looking at multi-stakeholder collaboration in order to go from research all the way through to how do we actually deliver to that last mile, it becomes extremely important to go beyond thinking, well, we have great legislation in Brussels on healthcare and all of the political will. We actually have to start thinking about how do we actually get things done, and what are those legislative and regulatory barriers that we need to work on in order to actually make it happen. So I'll give this as Jacqueline Bowman's vision. Again, as somebody with lived experience of multiple chronic medical conditions and a few neurodevelopmental, I'm on the record for that as well. I would love to see obesity not seen as size. I would like it to be seen accurately in terms of an adiposity-based chronic disease, which across the globe is actually implemented as such, not just from a technical perspective, so WHO technical teams, but also politically, because actually when we do not have political declarations and political will at all levels, it's very difficult for us. It doesn't matter how many sleeves we roll up, it's very difficult to actually have that legal basis to implement. So for me, my vision is to have both political will, which matches with the remit to actually have a shared, or should we say, a value-based healthcare and outcomes-based healthcare approach to obesity health service delivery, obesity health outcome measures, which are also linked to the health outcomes for people with cancer, because this is where we are today, not least because 20% of people with preventable adult cancers are actually directly there because the biology of obesity was never treated. So for me, the vision for 2030 is joined up, not just in terms of pre-existing conditions, but also implementation of protocols, clinical protocols, implementation of, should we say, geopolitical value chains, and most definitely that everyone involved, all of the different stakeholders, really understand and embed in themselves how we need to get this done. And hopefully that my blueprint for change via the IMI Sophia project in its 2.0 version, because we're taking it beyond, is a core element of that plan and piece for implementation.